We're excited to welcome you to this session on such an important topic. You know, the patient is at the center of our work, and staffing is an essential dimension of the entire patient experience. So balancing nursing workloads is a key performance imperative for hospitals and healthcare systems today.
Good afternoon. Thank you so much. Thank you for having me this afternoon. What I will spend some time sharing with you is our own experience introducing a commercial product to essentially implement all of the great research and evidence that were highlighted for us thus far. Premier Health is a integrated healthcare system located in Southwest Ohio. We are essentially based about 60 miles north of Cincinnati, and we cover somewhere around a 90-mile radius area. The next slide, just to give you a little perspective about who we are. We have 5 locations from an acute care perspective, just roughly a little over 1,900 beds. We have 3 freestanding emergency departments, over 100 sites of services across all of the communities that we serve. Roughly around 14,000 employees. That translates to about 4,500 nurses. We have a fully integrated healthcare chronic health record, which is epic for us, that goes across the continuum. And we have launched our healthcare plan as of January of 2014, just to give a context of who we are. On the next slide, what I am sharing with you is what was the case for change here at Premier Health to implement an acuity system. Clearly, it's very important for us, as many others, that our resources, and particularly our nursing resources, are extremely important to us. They're one of our most important assets that we have here at Premier Health. And taking into consideration our turnover, our vacancy, and more importantly, because our turnover and vacancy is somewhat much better than the national average, but from a workforce planning, everyone is very well aware that the supply of experienced nurses and the supply of nurses is not meeting our demand today, will most likely not meeting our demand tomorrow. And as we look at making sure that we resource all of our various units appropriately so that we can meet the needs of those we serve, we have to make sure that we're utilizing our resources appropriately. And to use our resources appropriately means that and everyone has been saying this for the entire time of this webinar, a patient is not a patient is not a patient. Everyone has different needs, and because they have different needs, and because different nurses have also different competencies, so it's important to have the right match so that we can stage the best possible for those we serve and then meet their needs. And that way we can better demonstrate our value contribution and enhance our business case of caring. It was also important for us to have full clinical integration as we thought about introducing an acuity system. We are in a state, Ohio, which requires for us to have an acuity system of some sort. We had a homegrown acuity system, if you will, and one that required the actual nurse to do a data entry on multiple times during the shift, which and that point was raised a few times, that the more the tool is embedded within the work, the more it's part of the work, and the less it requires additional activities and or tasks for the nurse. That's really what we were looking for, something that didn't require much work as possible. And lastly, the case for change was for us to ensure that everyone that comes and seeks services within Premier Health deserves to have the same level of care, if you will, no matter which organization you are, and that the resources available to them would be somewhat equal depending on what their needs are, hence decreasing the variation that we saw, as well as staffing equity. There is, if there is no objective tools to assign patients to nurses, it leaves a lot of subjectivity, and one would wonder whether the assignment is as equitable as it could be for both our patients as well as our nurses. Next slide. So as we identified the proper acuity system for us, we landed on a commercial-based system known as API, currently supported under it's a GE product. It essentially offers full integration with our current electronic health records, and it's a transparent acuity system. What I mean by that is that the nurses do not have to enter and check some boxes giving the system some information about the system that would generate an acuity level, if you will. All the information is, through some very complex algorithm in the background, creates an acuity for any given patient according to the activities that are occurring on this patient, the orders, the medication administration, the admission discharge transfer system, where they're located exactly in the organization, and all of the clinical elements and activities, interaction with family members, anything that's documented in the medical record in the appropriate places generates this acuity for this patient. And then what happens, is, in a very user-friendly ability, allows the nurse, the charge nurse or the team lead, for instance, to appropriately assign the right patient to the proper nurse and see in real time whether that assignment appears to be equitable from a team perspective or not, and then can make the adjustments right there and then. It's timely, actionable data right on the spot. And clearly for us also, it was the ability to find a good faith partner that would really work very closely with us and in deploying the system for us, and making the right changes along the way, because as we all know, very rarely can you find a system and implement as is without asking for some specialization to meet the needs of your specific organization. Next slide. To that end, in order for us to do that, we created a very strong governance around this, so that we could better support its implementation, but also at the same time it would meet the needs of everyone. So having a very strong governance, starting from the system CNO on to many other stakeholders, and really sponsoring this approach. We chose a service line implementation rather than the full bing bang approach. What we mean by that is we identified at first for us was our typical medical surgical unit, if you will. We worked very closely with all of the leaders and also our clinical leaders, our nurses who are touching the people we serve every day, and we worked very closely with them and implemented across all med-surg units across the entire organization, and then we went on to another service line. And that is how we implemented it over here. And clearly, like any other changes in the system, that was yet one more change, although the resistance that was met at the onset was quickly dissipated as soon as the first service line implementation was done, because the nurses very quickly saw that, well, number one, they didn't have to do any additional work, and it gave them tools to appropriately use the workforce that they had on any given shift. On the next slide is describing for you what our future state is. I'm really excited that we will be able to leverage all the work that my colleagues have developed in the business case and the modeling that they've developed, and utilizing that and utilizing our own internal data to further develop the business case of completely changing our budgeting process, utilizing and leveraging the acuity information that we're getting out of the system. So in other words, rather than using a traditional hours per patient day, we will be building a budget that will be based on acuity now that we have a year's worth of data. That exercise is was just initiated. We are on a yearly budget cycle. I'm starting our budget for the system right now. So we are already starting to look at that. So it's very exciting work. Difficult work nonetheless, because we're not aware of anyone who's really tackled it from that perspective. So we're trailblazing on this one, and are pretty excited to have the right partner to help us do that.